Winter is always a busy time for the London Ambulance Service and our NHS partners, and the COVID-19 pandemic may bring us some additional challenges this year. So we're busy preparing to make sure we're able to help those who need us and to ensure that we can respond to our patients as quickly as possible. Now, historically, our weekends are usually the busiest time during winter. However, we're expecting to be busier at different times this year, particularly on Mondays. But we will have lots of extra resource in place this winter. That includes crews on the road. It includes more 999 111 call handlers and other team members who will help to keep our ambulances on the road this winter. Our 999 and 111 control rooms are geared up to support callers this winter. In particular, 111 is a good place to go if you need self-care advice or if you don't need an emergency ambulance. We will have more clinicians on the end of the phone, and these are qualified medical personnel who can provide advice or can book a GP appointment for you if you need one. If we receive a large increase in demand for an emergency response, then we can increase the number of ambulances on the road. Our fleet and workshop teams are working really hard to minimise the amount of time our vehicles are off the road. And if we need additional support, we'll call on the AA, as we did during the peak of the pandemic, to help us fix vehicles and keep more vehicles on the road during winter. During the first wave of the pandemic, we trained a number of our paramedic students to support our call handling operations, and we can call on them if we need the support this winter. We also redesigned our logistics site at Deptford this year, which enabled us to deliver more than 1 million pieces of PPE to our stations, and this will help us to ensure that the supplies and equipment which our crews need gets to them this winter. At this busy time of year, for us to look after London, we need to make sure we look after our staff and volunteers. Their well-being is really important to us. So we make sure that our staff and volunteers have access 7 days a week to our well-being services. We have welfare wagons which travel around the emergency departments across London to make sure our crews have access to hot drinks and refreshments. And we're also encouraging and making arrangements to make sure our staff and volunteers have access to a flu vaccine so that they can protect themselves and protect our patients. From clapping on the doorstep to the letters of thanks we've received, we really appreciate all your support this year. And you can do your bit to help support us this winter. If you have an urgent health concern, but it's not a medical emergency, then contact NHS 111 first. You can get them online at www.111.nhs.uk, or you can call 111 if you're not online. If you think you need to go to A&E with an urgent health concern, but it's not a life-threatening matter, then again, contact 111 first. 111 have more doctors, nurses, paramedics, pharmacists, dental nurses and trained health advisors than ever before. You can also support us by playing your part to help reduce the spread of the virus. And you can do this by following the restrictions which are currently in place and following the guidelines which we have too. So just as a reminder, that's regular hand washing, social distancing, and remembering to wear a face covering when you're in the relevant places. Thank you for your support.